ਵੈਲਕਮ ਟੂ ਦਿਸ ਐਪੀਸੋਡ ਆਫ ਦ ਹਰਪ੍ਰੀਤ ਸਿੰਘ ਸ਼ੋ। ਅੱਜ ਦੇ ਸੈਗਮੈਂਟ ਵਿੱਚ ਅਸੀਂ ਤੁਹਾਡੀ ਮੁਲਾਕਾਤ ਕਰਾਵਾਂਗੇ ਮਿਸਟਰ ਮਾਈਕਲ ਵੋਲਕਰ ਨਾਲ, ਜਿਹੜੇ ਕਿ ਇੱਕ ਸੰਸਥਾ ਨਾਲ ਜੁੜੇ ਹੋਏ ਨੇ ਜਿਹੜੀ ਕਿ ਨੈਚੁਰਲ ਹੈਲਥ ਨੂੰ ਪ੍ਰਮੋਟ ਕਰਨ ਦੀ ਗੱਲਬਾਤ ਕਰ ਰਹੀ ਹੈ। ਕੀ ਇਹ ਸੰਸਥਾ, ਇਸ ਵੱਲੋਂ ਕੀ ਕੁਝ ਕੀਤਾ ਜਾ ਰਿਹਾ ਹੈ, ਇਸ ਸੰਬੰਧ ਵਿੱਚ ਜਾਣਕਾਰੀ ਲੈਣੇ ਆ ਮਾਈਕਲ ਵੋਲਕਰ ਤੋਂ। ਵੈਲਕਮ ਟੂ ਦ ਪ੍ਰੋਗਰਾਮ।
Thank you very much.
Thank you. Your organization, Health Action Network Society, what is it?
Well, we were founded back in the middle of the 80s when a lot of alternative and complementary therapies were marginalized.
Right.
And we have worked very diligently over the past 30 years to bring them more into mainstream. So we're an advocacy group, we're also a networking group. The Action stands for, as part of Health Action Network Society, stands for our sort of advocacy side, where we go and we work with the government to further the causes of complementary alternative practitioners.
Okay.
The networking side is where we bring in our professional members into networking events. We've created a wellness directory on our website so that you can easily find a practitioner that you're looking for in the complementary and alternative area.
Right.
So that's our main mandate:
Okay.
action and networking.
Okay. So Michael, why do you feel there is a need for the development of an alternative medicinal system?
Well, mainly because standardized medicine can only go so far. You know, it's great at doing ambulatory care, at stitching up a gaping wound, but once the initial symptoms have been taken care of, it's great to have support. And one of the great things that complementary therapies do is it supports wellness. It can support it before you get sick and after you get sick and along the way through your illness.
There's a health crisis we are finding all across the world today, and diseases which are unheard of are becoming more predominant today. What do you think, what's happening? Why is it that the health side is deteriorating, and despite lots of medicines being in the market, and you have pointed out to this direction that it is just a time bound solution for some time, but preventive as well as a long term stabilization of the body is not to be seen. So where do we stand?
Well, I think we are starting to see, you're right, a lot more new diseases, a lot more new maladies. A lot of them are gut related, which brings us to one of our causes right now, and that's we want to see less GMO foods in our food system, in our food industry. Right now it's very tough to find product that doesn't have some sort of GMO additive. We feel GMOs may be one of the roots to some of our current issues. We have a lot of allergies these days. We're not sure where those are coming from.
Right.
So there's definitely, I wouldn't call it quite a crisis right now, but there's a lot of room for concern about what's going on in the human body.
Right.
So one of our actionable programs right now at HANDS is the awareness of GMO foods. We'll be embarking upon a fairly aggressive campaign in 2014 to make people more aware of the limitations they have on choosing GMO-free food.
Okay, and when you say you're about your organization spearheading this message, what is the source of your funding? Is it some government funding, or how does the institution work?
Most of our funding at HANDS comes from our membership.
Okay.
So we have regular members, consumer members. These people pay a nominal fee per year to receive our quarterly magazine, to receive some of the other benefits like discounts with some of our professional members. Our professional members are people like naturopaths, massage therapists, traditional Chinese medicine practitioners, acupuncturists. Those are our professional members. They provide us with the bulk of our funding.
Right, and that's how the institution works.
And that's how
you talked about acupuncturists, you've talked about Chinese medicine thing. The land from where we come, Ayurveda is very predominant over there, and it's been continuing for ages. Is Ayurveda also having some roots in Canada also now?
We are definitely starting to see Ayurvedic medicine start to move ahead. I've actually been to Kerala in the south of India where
Right.
Ayurvedic medicine started,
Right.
and we're starting to see a lot more practitioners in that area, as well as the various herbal remedies that go along with it,
Right.
which is very positive. It's great to see that we're bringing in more international therapies
Right.
into not only BC but the rest of the country.
So, Michael, as far as the common people are concerned, what is their awareness level about all this? Let's talk, for example, the organic movement, which was started earlier. Is it deepening its roots, or still it is at a much small stage?
No, it's definitely deepening its roots. The organic choices have increased dramatically.
Right.
You can go into stores that specialize in organic product.
Right.
Ironically, they will never carry everything organic because there are so many products, processed foods, that are either that just aren't available in our organic forms, or are, what I'd like to say is contaminated by GMO ingredients. But the awareness, I think, is starting to become more and more significant in this area.
Okay.
I think that, for example, our quarterly magazine, we're now our circulation is up on that. We're getting more demands for information.
Right.
That's one of the other services Hands provides. We have lots of information available.
Right.
That's how we got our start, really, was providing reference materials. So that's part of our job, no question about it, is getting more information out into the general public.
Thank you. I'll go for a small break, come back and talk to you about, there's a debate going on organic also. How can a common person make sure that the money they are spending is actually what is being told? What kind of awareness should be there in the people? We will talk about this after the small break.
Sure, great.
ਲੈਣੇ ਜੀ ਇੱਕ ਛੋਟੀ ਜਿਹੀ ਬ੍ਰੇਕ ਅਤੇ ਹੁਣ ਤੱਕ ਜੋ ਗੱਲਬਾਤ ਹੋਈ ਮਾਈਕਲ ਵਾਲਨਰ ਜਿਹੜੇ ਕਿ ਸੰਸਥਾ ਨਾਲ ਕੰਮ ਕਰਦੇ ਨੇ ਜਿਹੜੀ ਕਿ ਆਲਟਰਨੇਟਿਵ ਮੈਡੀਸਿਨਸ ਦੇ ਬਾਰੇ ਲੋਕਾਂ ਦੇ ਵਿੱਚ ਚੇਤਨਾ ਵਧਾਉਣ ਦੀ ਕੋਸ਼ਿਸ਼ ਕਰ ਰਹੀ ਇਹਨਾਂ ਨੇ ਕਿਹਾ ਕਿ ਓਵਰ ਦ ਈਅਰਸ ਕੈਨੇਡਾ ਵਿੱਚ ਵੀ ਇਹ ਚੀਜ਼ ਪ੍ਰਚਲਿਤ ਹੋ ਰਹੀ ਹੈ ਜਿੱਥੇ ਚਾਈਨੀਜ਼ ਮੈਡੀਸਿਨ ਦੀ ਇਹਨਾਂ ਨੇ ਗੱਲ ਕੀਤੀ ਨਾਲ ਇਹਨਾਂ ਨੇ ਕਿਹਾ ਕਿ ਆਯੁਰਵੇਦਾ ਵੀ ਸਟਰੋਂਗ ਫੁੱਟਹੋਲਡ ਕੈਨੇਡਾ ਵਿੱਚ ਲੈ ਰਹੀ ਹੈ ਤੇ ਲੋਕ ਆ ਕੇ ਇਹਨਾਂ ਨੂੰ ਜੁਆਇਨ ਕਰ ਰਹੇ ਨੇ ਇਹ ਸੰਸਥਾ ਚਲਦੀ ਹੈ ਡੋਨੇਸ਼ਨਸ ਦੇ ਨਾਲ ਜਿਹੜੀ ਇਹਨਾਂ ਦੀ ਮੈਂਬਰਸ਼ਿਪ ਹੈ ਉਸ ਦੇ ਸਹਾਰੇ ਚਲਦੀ ਹੈ ਪਰ ਲੋਕਾਂ ਵਿੱਚ ਚੇਤਨਤਾ ਲਿਆਉਣ ਦੀ ਕੋਸ਼ਿਸ਼ ਕਰ ਰਹੀ ਹੈ ਕਿ ਆਪਣੀ ਸਿਹਤ ਦੇ ਬਾਰੇ ਅਸੀਂ ਠੀਕ ਹੋਈਏ ਸਾਨੂੰ ਪਤਾ ਹੋਵੇ ਕਿ ਅਸੀਂ ਕੀ ਖਾ ਰਹੇ ਹਾਂ ਇਸ ਵਾਸਤੇ ਇਹ ਮੈਗਜ਼ੀਨਸ ਵੀ ਕੱਢਦੇ ਨੇ ਕੁਆਰਟਰਲੀ ਅਤੇ ਨਾਲ ਹੀ ਇਹਨਾਂ ਨੇ ਕਿਹਾ ਕਿ ਅਸੀਂ ਆਪਣੀ ਵੈਬਸਾਈਟ ਦੇ ਉੱਤੇ ਵੀ ਇਨਫੋਰਮੇਸ਼ਨ ਦਿੰਦੇ ਹਾਂ ਕਿ ਕਿਹੜੀ ਚੀਜ਼ਾਂ ਜਿਹੜੀਆਂ ਨੇ ਉਹ ਬੈਟਰ ਨੇ ਤੁਹਾਡੀ ਸਿਹਤ ਵਾਸਤੇ ਗੱਲਬਾਤ ਚਲਦੀ ਰਹੇਗੀ ਕਿ ਆਰਗੈਨਿਕ ਬਾਰੇ ਜੋ ਮੈਂ ਗੱਲ ਕੀਤੀ ਕਿ ਕਿਸ ਤਰੀਕੇ ਨਾਲ ਆਮ ਜਨਤਾ ਨੂੰ ਪਤਾ ਲੱਗੇ ਕਿ ਜਿਹੜੇ ਉਹ ਪੈਸੇ ਖਰਚ ਰਹੀ ਹੈ ਕਿ ਉਹ ਵਾਕਿਆ ਵਿੱਚ ਹੀ ਆਰਗੈਨਿਕ ਪ੍ਰੋਡਿਊਸ ਖਰੀਦ ਰਹੀ ਹੈ ਇਸ ਬਾਰੇ ਗੱਲ ਕਰਨੀ ਹੈ ਇਸ ਬ੍ਰੇਕ ਤੋਂ ਬਾਅਦ ਸਵਾਗਤ ਕਰਦਾ ਹਾਂ ਜੀ ਇੱਕ ਵਾਰ ਫਿਰ ਆਪ ਸਭ ਦਾ ਅੱਜ ਦੇ ਇਸ ਪ੍ਰੋਗਰਾਮ ਵਿੱਚ ਅੱਜ ਦੇ ਇਸ ਹੈਲਥ ਸੈਗਮੈਂਟ ਵਿੱਚ ਤੁਹਾਡੀ ਮੁਲਾਕਾਤ ਕਰਵਾ ਰਹੇ ਹਾਂ ਮਾਈਕਲ ਵਾਲਨਰ ਨਾਲ ਜਿਹੜੇ ਕਿ ਡਾਇਰੈਕਟਰ ਆਫ ਆਪਰੇਸ਼ਨਸ ਹਨ ਇਹ ਸੰਸਥਾ ਹੈਲਥ ਐਕਸ਼ਨ ਨੈਟਵਰਕ ਸੁਸਾਇਟੀ ਨਾਲ ਇਹਨਾਂ ਨੇ ਜੋ ਹੁਣ ਤੱਕ ਗੱਲਬਾਤ ਕੀਤੀ ਆਓ ਕੁਝ ਹੋਰ ਇਨਫੋਰਮੇਸ਼ਨ ਲੈਂਦੇ ਹਾਂ So before the break, you were talking about that organic movement is gaining ground. People are now spending money on this, but still there is a debate on this. That what you are having, is it actually organic? And for example, we hear organic eggs, organic milk, even organic beef. Also, this is what people are talking. So what does this basically mean, and how should one be aware that what you are buying it is actually organic?
Yes, good question. You're right. There is a lot of concern about that. The main thing about organic foods is it should be certified. So certified, you'll actually see that on the label, on the packaging. It'll say certified organic.
Right.
And there is an arm's length organization, arm's length from the government organization that does go out and make sure that organic product is organic product, and they certify it.
Right.
So that's number one. If you're looking for GMO-free product, that's a little bit more difficult. You have to probably go into a health food store or at least an organic oriented type food store to find GMO-free product, but there is as well the start of a certifying process for GMO product as well. So you will see some product out there that is been certified GMO-free.
Right. Okay. So that awareness should be there when you are buying something.
Yes.
That sticker or that.
When it comes to produce, you will notice that there is a sticker on apples, etc.
Right.
There's a number on that sticker. That's the number that the person at the cash register will key in.
Right.
If it starts with a 9, it's organic.
Okay.
So that's
so
an
9
easy
is
way.
organic.
9 is organic. Yes.
Okay,
Yeah.
that's great. Thank
Yeah.
you. Another thing is that while this alternative medicines concept is gaining ground, but also there are concerns on this factor also, that the things which are being brought, many a times there are a lot of things which are mixed up, which are like metallic or even steroids also, to give a boost to the body and all that. So over there, how is your society trying to create awareness about this? And as you talked about Ayurveda also, what to make sure when you are buying the products, how to make sure that what you are buying is, you know, pure and it is good?
Well, one of the best things you can do is talk to the people in the food store. You know, talk to the staff, talk to the produce manager if it's product that you're concerned about. If you're talking about metals getting into products, those are usually that's been happening in supplements.
Right.
And so you would probably go to your pharmacist and talk to them about that.
Right.
Or you would go to a pharmacy assistant. So don't be afraid to talk to the people, ask questions in the stores. Don't
Right.
trust the label necessarily.
Right.
You know, I'd love to, and Health Canada would love me to say, hey, just read the label. No,
Right.
it's not as easy as that.
Right.
It's a very good idea to actually ask the questions of the people in the stores.
And lastly, towards then, what would you like to say to the mostly the South Asians who are watching this program today?
Well, you know, we are a non-profit organization, HANDS, and we are supported by people, by the consumers out there.
Right.
So we're very easy to find on the internet. It's just HANS, HANS.org. The strength of our organization, the strength of our advocacy, the strength of our ability to inform people is the strength of our membership. So I would
Right.
encourage people to join the organization. As well, specifically for the South Asian community, we do have a lot of practitioners that are based in Surrey and Richmond in
Okay.
South Vancouver. So if you want, we can put you in touch with those practitioners.
Thank you very much for your time. It was a pleasure having you. Thank
Okay,
you.
well, thank you very much.
ਥੈਂਕ ਯੂ ਸੋ ਹੁਣ ਤੱਕ ਜੋ ਅਸੀਂ ਗੱਲਬਾਤ ਕੀਤੀ ਉਸ ਵਿੱਚ ਮਾਈਕਲ ਨੇ ਸਾਨੂੰ ਦੱਸਿਆ ਹੈਗਾ ਕਿ ਮੈਂ ਇਹਨਾਂ ਨੂੰ ਪੁੱਛਿਆ ਕਿ ਕਿਵੇਂ ਪਤਾ ਲੱਗੇ ਕਿ ਕੋਈ ਪ੍ਰੋਡਿਊਸ ਜਿਹੜਾ ਹੈ ਉਹ ਆਰਗੈਨਿਕ ਹੈ ਜਿਸ ਵਾਸਤੇ ਤੁਸੀਂ ਪੈਸੇ ਖਰਚ ਰਹੇ ਹੋ। ਤੇ ਇਹਨਾਂ ਨੇ ਕਿਹਾ ਕਿ ਜਦੋਂ ਤੁਸੀਂ ਸਟੋਰ ਵਿੱਚ ਜਾ ਕੇ ਖਰੀਦਦੇ ਹੋ ਕੁਝ, ਜੇ 9 ਦੇ ਨਾਲ ਉਹ ਲੇਬਲ ਸਟਾਰਟ ਹੋ ਰਿਹਾ ਹੈ ਤਾਂ ਉਹ ਜਦੋਂ ਕੀ ਮੈਂਸ਼ਨ ਕੀਤਾ ਜਾਂਦਾ ਹੈ ਤਾਂ ਉਹਦਾ ਮਤਲਬ ਹੈ ਕਿ ਇਹ ਆਰਗੈਨਿਕ ਹੈ। ਉਸ ਤੋਂ ਇਲਾਵਾ ਇਹਨਾਂ ਨੇ ਇਹ ਵੀ ਦੱਸਿਆ ਹੈਗਾ ਕਿ ਜਿਹੜੇ ਮੈਟੈਲਿਕ ਚੀਜ਼ਾਂ ਜਿਹੜੀ ਮਿਕਸ ਹੁੰਦੀਆਂ ਨੇ ਉਸ ਤੋਂ ਕਿਵੇਂ ਬਚਿਆ ਜਾ ਸਕਦਾ ਹੈ ਕਿ ਤੁਸੀਂ ਜ਼ਰੂਰ ਜਾ ਕੇ ਸਿਰਫ ਜੋ ਲੇਬਲ 'ਤੇ ਲਿਖਿਆ ਗਿਆ ਉਹੀ ਨਾ ਦੇਖੋ। ਆਫ ਕੋਰਸ ਕੈਨੇਡਾ ਵਿੱਚ ਜਿਹੜੀ ਚੀਜ਼ ਬਣੀ ਹੋਈ ਹੈ ਅਤੇ ਉਸ ਨੂੰ ਜਿਹੜੀ ਸਾਡੀ ਇੱਥੋਂ ਦੀ ਹੈਲਥ ਕੈਨੇਡਾ ਉਸਨੇ ਅਪਰੂਵ ਕੀਤਾ ਹੈ ਉਹ ਵਧੀਆ ਗੱਲ ਹੈ, ਲੇਕਿਨ ਉਸ ਦੇ ਬਾਵਜੂਦ ਤੁਸੀਂ ਜਾ ਕੇ ਹੈਲਥ ਜੋ ਹੈ ਸਟੋਰ ਦਾ ਮਾਲਿਕ ਜਾਂ ਜੋ ਉੱਥੇ ਫਾਰਮਾਸਿਸਟ ਜਾਂ ਜੋ ਵੀ ਉੱਥੇ ਕੋਈ ਹੈਲਥ ਫੂਡ ਸਟੋਰ ਵਿੱਚ ਕੰਮ ਕਰਦਾ ਹੈ ਉਹਦੇ ਨਾਲ ਜ਼ਰੂਰ ਗੱਲਬਾਤ ਕਰੋ, ਉਹਦੇ ਤੋਂ ਸਲਾਹ ਲਓ, ਫਿਰ ਜਾ ਕੇ ਪ੍ਰੋਡਕਟ ਲਓ। ਤੇ ਨਾਲ ਹੀ ਇਹਨਾਂ ਨੇ ਸਾਊਥ ਏਸ਼ੀਅਨਸ ਨੂੰ ਵੀ ਕਿਹਾ ਕਿ ਇਹਨਾਂ ਦੀ ਸਕਰੀਨ ਦੇ ਦਿੱਤੀ ਹੋਈ ਵੈਬਸਾਈਟ ਦੇ ਉੱਤੇ ਜਾ ਕੇ ਤੁਸੀਂ ਹੋਰ ਇਨਫੋਰਮੇਸ਼ਨ ਲੈ ਸਕਦੇ ਹੋ। ਅਤੇ ਇਹ ਨਾਨ ਪ੍ਰੋਫਿਟ ਸੰਸਥਾ ਜੋ ਹੈ ਇਹ ਸਰੀ, ਰਿਚਮੰਡ ਅਤੇ ਸਾਊਥ ਵੈਂਕੂਵਰ ਵਿੱਚ ਵੀ ਬਹੁਤ ਸਾਰੇ ਪ੍ਰੈਕਟੀਸ਼ਨਰਸ ਜਿਹੜੇ ਇਸ ਫੀਲਡ ਨਾਲ ਜੁੜੇ ਹੋਏ ਨੇ ਉਹ ਕੰਮ ਕਰਦੇ ਨੇ, ਉਹਨਾਂ ਦਾ ਤੁਸੀਂ ਬੈਨੀਫਿਟ ਲੈ ਸਕਦੇ ਹੋ।